Hello everyone, and welcome back to our channel. In today's video, we will be discussing a deeply important and sensitive topic. Sudden Infant Death Syndrome, or SIDS. SIDS is a tragic and devastating occurrence that can strike without warning. And it's crucial for parents and caregivers to be informed about its causes, prevention strategies, and how to raise awareness to protect our little ones. So, let's dive into the facts and information surrounding SIDS. What is Sudden Infant Death Syndrome, SIDS? Sudden Infant Death Syndrome, SIDS, also known as crib death, is characterized by the abrupt and unexplained passing of an infant. This occurs when a post-mortem examination fails to ascertain the underlying cause of death. The peak age for SIDS is around 3 months, with approximately 90% of cases happening before the infant reaches 6 months of age. This phenomenon tends to be more prevalent during the winter and early spring months. Infants who are identified with SIDS typically possess a clean bill of health and no history of prior medical issues. Tragically, they are often found deceased after being placed in their cribs for sleep. Age range. SIDS is most common in infants between the ages of 1 month and 1 year, with the highest risk occurring between 1 and 4 months of age. However, it can occur up to 1 year of age. Causes and risk factors. The exact cause of SIDS is still unknown, but it is believed to result from a combination of factors that can compromise an infant's ability to wake up from sleep when their oxygen levels drop or they experience a breathing difficulty. Factors that may increase the risk. 1. Sleep position. Babies placed on their stomachs or sides have a higher risk of SIDS. The Back to Sleep campaign recommends placing babies on their backs for all sleep times. 2. Sleep environment. Soft bedding, pillows, stuffed animals, or loose blankets can pose suffocation hazards, increasing the risk of SIDS. A firm mattress with a fitted sheet is recommended. 3. Sleep location. Sharing a bed with an infant, bed sharing, can increase the risk of SIDS, especially if the bed is soft. The baby is placed between adults, or if the caregivers smoke. 4. Maternal smoking. Mothers who smoke during pregnancy or expose their infants to secondhand smoke after birth are at a higher risk of having a baby who dies from SIDS. 5. Prematurity and low birth weight. Premature babies or those with low birth weight have a higher risk of SIDS due to their underdeveloped systems. 6. Multiple births. Twins, triplets, etc., are at a higher risk due to their often lower birth weights and potential for respiratory issues. 7. Sleep environment and overheating. Babies who are dressed too warmly or are in an overly warm sleep environment are at an increased risk. 8. Siblings with SIDS. If siblings have experienced SIDS, it could raise the risk for subsequent infants. 9. Previous near-SIDS event. A near-SIDS event with a previous child could indicate vulnerability. Underlying causes. 1. Viral influence. Some research suggests a potential viral connection. 2. Hypoxia hypothesis. This theory proposes oxygen deficiency as a possible trigger. 3. Apnea hypothesis. It posits that a pause in breathing might play a role. 4. Clostridium botulism toxin. There's speculation regarding the involvement of this toxin. 5. Vaccine association. A tenuous link to diphtheria, tetanus, and pertussis vaccines has been considered. 6. Parental smoking. Incidence appears to be higher in households where parents smoke. Prevention strategies. While SIDS cannot be entirely prevented, there are important steps that parents and caregivers can take to reduce the risk. 1. Back to sleep. Always place babies on their backs for sleep, during naps and nighttime sleep. 2. Safe sleep environment. Use a firm mattress with a fitted sheet. Keep the sleep area clutter-free, no pillows, toys, or loose bedding. 3. Sleeping alone. Babies should sleep in their own sleep area, such as a crib or bassinet, rather than sharing a bed with adults or other children. 4. Sleep location. Use a safety-approved crib or bassinet that adheres to the recommended guidelines. 5. Temperature control. Keep the room at a comfortable temperature and avoid overheating the baby. 6. Avoid smoke exposure. Pregnant mothers should not smoke, and infants should be kept in smoke-free environments. Awareness and support. Raising awareness about SIDS is essential to educate parents, caregivers, and healthcare professionals about the risk factors and prevention strategies. Support systems are vital for families who have experienced the loss of an infant due to SIDS, including counseling and bereavement services. Remember, while these strategies can help reduce the risk of SIDS, it's important to consult with your pediatrician or healthcare provider for personalized guidance and recommendations based on your specific situation. Diagnostic considerations. Autopsy crucial. The only definitive diagnosis of SIDS is through autopsy. Autopsy findings. Autopsy findings point to pulmonary edema, intrathoracic petechiae, and subtle changes suggesting chronic oxygen deprivation. These findings help exclude suffocation and aspiration as causes of death. Nursing focus. Impaired gas exchange diagnosis. A diagnosis of impaired gas exchange might be warranted. Impaired spontaneous ventilation. Similarly, impaired spontaneous ventilation could be indicated. Treatment and interventions. Limited treatment. No specific treatment exists for SIDS itself. Near-SIDS care. In the case of resuscitation attempts during a near-SIDS event, continuous monitoring is initiated. Drug protocols. If resuscitation is pursued, medications like epinephrine, atropine, and possibly sodium bicarbonate are administered based on pediatric advanced life support guidelines. Nursing strategies. Emotional support. Given the lack of resuscitation options, providing emotional support for the grieving family is paramount. Grief and guilt. Grief often intertwines with guilt, necessitating a supportive outlet for expression. Parent-infant interaction. Encouraging parents to hold, touch, and say goodbye to the infant assists the grieving process. Spiritual support. Arranging spiritual support can aid parents in dealing with their grief. Information sharing. Providing educational materials on SIDS and suggesting support groups can be beneficial for the family. Advocacy. If a police investigation ensues, being an advocate for the parents can be reassuring. Educational emphasis. Explaining SIDS. Offering a clear explanation of SIDS as a cause of infant death. Preparing for interaction. Preparing families for the infant's post-mortem appearance, encouraging touch and interaction. End-of-life information. Sharing information on end-of-life procedures to help families navigate the difficult process. Thank you for watching today's video. If you found this information valuable, please give us a thumbs up and consider subscribing for more important topics like this. Feel free to share your thoughts, questions, and experiences in the comments section below. Stay informed, stay safe, and let's work together to protect our little ones. Until next time, take care.